Yes. Yes, Kibibot. Kibibot is one of our panelists. He's from IPC team in KNH. We also have Dr. Dorothy Ewak. She's the pharmacovigilance specialist who will take us through about the side effects and everything we need to know about adverse effects on COVID. She will address the questions. Joining us also is Dr. Nyukuri. He's our infectious disease specialist, and Hina from WHO. Sorry, WHO had started a movement on Viral Check Africa, which we have partnered with. The movement is about making sure we have factual information on the virus and we stop all this false information which is going on social media and what have you. So, Dr. Ewak, how are you?
Good morning, Dr. Amina. I'm very well, and thank you for this opportunity to share with those who are joining us.
Yes, thank you very much for coming and presenting on very important information. Maybe we can start off with a little bit presentation from your end, and we can continue with the question and answers.
Okay, thank you, Dr. Amina. I'm going to have my screen shared from the research and programs computer, but as that is being loaded, and to just by introduction, as Dr. Amina mentioned, I am a pharmacovigilance expert. Now, when it comes to pharmacovigilance, what it is, your pharmacovigilance looks at, it is monitoring safety and efficacy and quality of medicines that we are using, and not just the medicines, but also supplements, cosmetics, vaccines, a whole range of items that we use either to cure, to diagnose, or treat various conditions. So if we can move just ahead to just highlight what are we doing, why are we interested in being able to communicate to the public with regards to pharmacovigilance of the public, pharmacovigilance of vaccines, is that we've noticed there's a lot of concern and a lot of misconceptions that are going around. And my colleague from the board, Dr. Krista Benhaemba, is going to also just highlight on the same regarding the vaccine vigilance. But as a hospital, we have put up a tool to be able so that to facilitate those who experience any side effects from the vaccines, and we say like there's no medicine which will not have a side effect. So equally, the vaccine will also have a side effect. So we have put in place a tool for those who encounter the side effects to be able to report, and then we can be able to do a follow-up and find out which ones are most occurring in our population, and also be able to just help to reassure. And for those which require additional medical attention, then those you have to refer to a health center, to a health facility, either where you got your job or the nearest health facility, so that you can get attention. So just looking at what are the common side effects that have been reported since we started our vaccination in Kenyatta on 5th of March, what it is those who have been vaccinated have been experiencing is actually what is already listed in the product information for the COVID-19, the AstraZeneca vaccine that we are giving to our patients. As what you can see on the slides, that most people are experiencing generalized malaise, pain or swelling at the site of injection. There are a number who complain of headaches, muscle or joint pains. There are few who have mentioned that they either have nausea, diarrhea, or vomiting. Some experience fever. So what it is that we are finding our population, at least the health care workers and those who are vaccinated in our facility experience, is actually what is already communicated in the product information. And I think when you come to the vaccine center, usually some of these are highlighted. Now, as we have been continuing with the process, we've been getting a number of safety concerns, particularly those who are either referring to issues regarding the pregnant and lactating mothers, whether they should get vaccinated, whether it is safe that if you are vaccinated, then you discover that you're pregnant later, whether it is safe to get a second jab. The message we are communicating, at least from SIG, is that the message we are communicating is that it's as long as you're in the priority group, that is, you're in essential services, the disciplined forces, the teachers, the healthcare workers, those above, okay, I'm not sure whether those above 58 will be pregnant, but as long as you're in the priority group, then you have been already assessed as those who are at high risk of getting the COVID infection. And therefore you have to do a balance between the risk of you getting infected, and that would be worse if you are infected and you, as opposed to if you get the vaccine to manage the infection. So I think we will probably be having a lot of questions, and I think we have Dr. Nyukuri on call who can also be able to support in terms of the evidence and how to address issues with regarding the pregnant and breastfeeding mothers. So next slide. So now, as I said, that when you consider whether you're in the high risk group and who have been highlighted as those who are in the priority group, then you need to make a clear choice of how you're going to protect yourself. And vaccination, actually, we know vaccination works for a lot of viral infections, and therefore we encourage that is done. And should you, we can go back to the second slide. Should you be vaccinated and you encounter any of these side effects that are listed, we encourage you to report. There's the tool from the Pharmacy and Poisons Board, and I'm sure my colleague, Dr. Haemba, has joined. She can be able to guide us on how it is you can report. If you're as a member of the public, how do you report? But the healthcare workers, they have access to the tool to give a lot more information with regards to the adverse effects reported. So thank you. I think we can end the presentation there, then we can work more in terms of the Q&A. Back to you, Amina.
Thank you, Doc, for that presentation. I can see Dr. Kibiwot, do you have any comments before we go into the Q&A?
Oh, maybe the only comment I can have is about the precaution when it comes to IPC. Despite that we're having a vaccine round, that does not mean that we now let down our guard and put on masks when we want. We still have to practice all the IPC precautions which are necessary. Of most important is wearing of a mask, a quality mask, and wearing it properly. The second is we still have to avoid crowded areas where it is possible. We don't need to attend weddings when there is no need for us. We don't need to go to the market when there is no need for us. Those are the precautions we still have to continue doing, and of course, hand hygiene. So maybe that's what I can say for now as I wait for the question and answer session. Thank you, Amina.
Thank you. Christabel, Dr. Christabel, she's also a pharmacovigilance specialist from Ministry of Health, I think. Yes, Dr.
Can you hear me?
Yes, we can.
Okay. So sorry, I think I didn't get the link on time, but I'm here. So I'll just share a little presentation on safety monitoring of the vaccines. So just a second. Okay. Yeah, so just to follow up on what Dr. Yuak has shared. So in Kenya, we have the pharmacovigilance system where we do monitoring of safety and quality of medicines, or rather medical products and health technologies, which include medicines, vaccines, blood products, medical devices, and also monitoring medication errors. But today we'll just focus on safety monitoring for vaccines, and more so safety consideration during COVID-19 vaccination. So just a reminder, because I know people have heard about the term pharmacovigilance, and the official definition of pharmacovigilance, basically it's just science and activities relating to the detection, assessment, understanding and prevention of any adverse event or drug-related problems. So we look at, in terms of how do we identify a suspected adverse event, then it is assessed, and then by understanding, meaning that during investigation, we are able to collect data that helps us understand these adverse events better, how to manage them, and then we are able to see how to also prevent them. And the main reason why pharmacovigilance is essential, it's because we are trying to ensure patient safety. And remember, there are issues to do with population diversity, where you find that during clinical trial, there's a different population that is used for studying the efficacy and safety of these drugs. And it's important that as it is being translated to larger population, we are able to conduct pharmacovigilance. There could be issues of drug-drug interaction. And then we also appreciate that we have people who could be using traditional and herbal medicines that can also interfere with the general metabolism of the drugs. And then, so why do we do pharmacovigilance? As I mentioned, because we need to identify any adverse events that follow immunization, and then we'll be able to assess them. And after we've understood the pattern, we communicate so that people are able to know what to expect and how to manage them. And so when you're talking about adverse event following immunization, in simpler terms, this is something that is unexpected. It could be inappropriate or inconvenient that occurs after someone has been immunized, and then it does not necessarily have a causal relationship with the vaccine, meaning it is anything that happens after someone has been vaccinated. Like, let's say, for example, if you get vaccinated today, and then as you're walking out of the vaccination center, you're hit by a car and you break your leg, we will still record that as an event that occurred after immunization, though it is not really the vaccine that made you break your leg. And then it can also be found based on maybe lab analysis that can be done to find out if there is any change in your normal, maybe liver function test or kidney test or your blood levels. So in Kenya, this is how we do monitoring of the vaccines. So we have all the way from the patient and caregivers. So they are able to so like the caregivers or the patient, these are the ones who will be the first people who will notice that there is an adverse event that is occurring. So they should report to the healthcare worker. So these are the channels that currently exist. So if it is being done manually through using the manual forms that are available, it will be sent to the healthcare worker, who will send to the county teams that are there using the MOH county, sub-county teams. We have a public health nurse who is in charge of this, and they're supposed to conduct investigation, especially if it's a serious AEFI, within 24 hours. And then the information will be captured within the DHIS2, that is the health information system. And then the information goes to the epidemiologistician at the county. This is the one who does all logistics around the vaccine, how many people are vaccinated, and if there's any reaction that occurred. And we also have the electronic reporting system, which we are more so encouraging during this COVID-19 vaccination, where we can have both the healthcare worker or the patient reporting directly to the PPB. So at PPB and the National Vaccines Program, we have the National Safety Advisory Committee, and we are the secretariat, both of us, who look at these reports. And then we are able to give advice to the MOH Director General and also the CEO Pharmacy and Poisons Board. And we also submit this information to WHO because we are part of the International Drug Monitoring Program. And it's also the requirement by market authorization holders that they forward these reports, any reports that come to them, to PPB, because it is mandated that they have to monitor all the products they've put onto the market. So these are just some of the common adverse events following immunization that we would expect in case we are taking the AstraZeneca vaccine, which is being given through the MOH program. And just an emphasis that most of them have been reported as mild and moderate. And as you can see, the very common ones, and this is just resonating with what Dorothy has reported, will be headache, nausea, fever, fatigue. We have an injection site where people experience tenderness. Some of them say it's swelling, some say it's turning red or bruising. And then we have some which are also common. And when we talk about common, it's like they occur in one out of every 100 people who are vaccinated. And this include vomiting. And then we can also have the uncommon ones, which include things like this decrease in appetite, dizziness, abdominal pain, excessive sweating, pruritus, and rash. So those are just some of the adverse events that someone is likely to experience. Then in terms of the Sputnik vaccine, again, the very common ones include fever, chills, headache, the injection site, and then we have the common ones that have like nausea, loss of appetite, vomiting, and then we also have the uncommon ones. And the uncommon ones, these ones is whereby they can be diagnosed when you go back to the facility, things like change in liver enzymes. So those ones are what has been reported as uncommon events. So what should be reported? So we are saying that all adverse events following immunization should be reported, whether it is serious or unserious. And even if it is something that is documented, we still need to report it so that we can see what is the pattern that is occurring within our population. And then we need to report anything that occurs that is unexplained within 30 days of vaccination. And then the fact that this is a new vaccine, so the reason why we are saying that we report all events, because it could be something that is not documented, but when we report it, we are able to know if it is a signal that needs to be followed up. And then anything that causes parental or community concern, this also needs to be reported. And should there be any swelling or soreness at the site, as much as it's expected, it's important that it is reported. So just to emphasize again that all of them should be reported, we encourage online reporting, and both healthcare workers and non-healthcare workers can report. So when you go to the PPB website, this is how the portal looks like, and this is the URL that you need to type in as you're going in. So as a healthcare worker, there is a different platform where you need to log in, but as a member of public, when you come, you just click on this icon, and then you're able to report. And this is how the public reporting form looks like. So you just put in the details of the person reported, the county where it's reported from, and then the patient name or initials. You don't need to put the name, you can put the initials. And then just when you click on adverse reaction, it will give you a list of what you can tick. And if it is not there, you have the option of typing others and then you put in. So once we get this report, we'll get in touch with the facility where you are vaccinated to get more information. Alternatively, you can send an email or call this number, and someone will guide you through and be able to fill the form on your behalf. So currently, these are the reports that we've seen, mostly issues of headache, fever, injection sites, nausea, vomiting. Again, it's just basically what is documented. And that's why it's important that we keep on reporting so that we are able to get more information and more data on the same. And it's important that we report so that we get information to enable us monitor the vaccines better, to enhance also program, because if we are able to know that what we are experiencing is not different from what is documented, and then it gives us the confidence that we can actually get these vaccines and we'll be able to be safe. And then we need local data, because remember, most of the data that we have for most of our medicines and our vaccines is from a global perspective, but it's important to see what is happening within our borders, within our country, to see if we are able to make any corrective actions and to make sure we do the program well. So we are told that if you're unsure of whether to report, just be proactive and report the event. And then just key points to remind us so that we don't have this mystery around the vaccines. The non-safety profile of these vaccines, as you can see, it's just similar to the other existing vaccines, like measles vaccines. When you're given, we see children crying, we see children having fever. So it is not unique. Like if someone gets yellow fever, there are people who have injection site pain. At the same time, they also experience fever. So it is known. So we need to report all events so that we have adequate medical intervention should there be need for it. And because this is a new vaccine, it is essential that we notify any safety concerns that we have so that it can help us support, conduct investigations and just be sure that the vaccines are actually safe. And should there be any events, there are things that are manageable. And as I conclude, you don't need to be certain, but just be suspicious and then report all suspected adverse events. Thank you. Over to you.
Yeah, thank you, Dr. Ray, for that. I believe Dr. Hila has, yeah, it's okay. So thank you for that. Maybe we can start the Q&A. I was hoping to see some of the panel members. There are questions regarding AstraZeneca. Is AstraZeneca the only vaccine available in the country?
So currently we have two vaccines. We have AstraZeneca and Sputnik 5 vaccine. So AstraZeneca is being supplied through MOH, and this is free of charge, whether you're getting it from the public health facilities or private facilities. But Sputnik V is a commercially available vaccine. So there are private facilities that have it available for, but it's not free of charge as compared to the AstraZeneca.
Regarding the same topic, is Sputnik authorized by government of Kenya? And if it is, do you know where somebody can get the jab from?
All the two vaccines have received what we call emergency use authorization, and meaning they have they've been authorized to be available on the market. I am not very sure about the private facilities that have them. That one I would need to check. But yeah, what I know, it's being availed through private facilities.
Okay, okay. Maybe we can know specific, probably somebody is aware in the panel and can inform us about the specific facilities where it's available. But while we are waiting for that, there are questions here regarding safety concerns with underlying conditions such as diabetes, hypertension, cancer, HIV. Are these people eligible for COVID-19 vaccine?
Yeah, so Amina, just to clarify, the private facilities, the list has been submitted to MOH, which will approve, and then we'll be able to get the official list of the facilities that will be offering Sputnik V vaccine. Thank you.
Thank you. So we'll work with the communication team to get it circulated once the list is out. But now regarding the comorbidities, what are your advice, take-home message for the audience?
Dr. Amina, I don't know whether we have Dr. Nyukuri on the call, but if I could partially answer that, when the study for the efficacy of COVID, at least the AstraZeneca vaccine was done, there are those comorbidities which are associated with high risk of severe COVID disease. Those include obesity, cardiovascular disease, respiratory disease, diabetes, now cardiovascular, thinking hypertension, heart-related illnesses. So in those groups, because we found that their risk of severe disease is higher, they're still among those ones who can still benefit in terms of the safety and efficacy. The safety and efficacy in these same groups was found to be good, that you can still use it if you have those comorbidities. Now, at least that is data regarding those two. If you're in the obesity, cardiovascular disease, respiratory disease, and diabetes. So I don't know if we have anyone else in the course, but even with the people who have living with HIV, vaccination they're also among the group who are recommended for vaccination.
Yesterday I had a very interesting encounter. There was somebody who had sickle cell anemia. She was really worried about getting a crisis. Do you have any data on people with sickle cell anemia? Dr. Ewak?
As it is, okay, we don't have at least hospital data with regards to that. I'm hoping any of my other colleagues, Dr. Kinuthia or Dr. Ngumbao, if they have come across that. But in terms of sickle cell disease, no data as yet. But I believe that if they belong to the priority groups, that means they're already identified as those who are at high risk. And they should be able to see their healthcare provider to see whether they will benefit more from the vaccine than not getting it, than risk infection. Thank you.
Thank you. Sorry, there are questions here regarding face shield and which since we have so many face masks and which one is recommended for people to take? Maybe Kibiwot, you can answer that on advising the public on how to know which if the mask they're buying is effective.
Okay, let me start with the face shield. Face shield research has proven that it's not necessary because you're not likely to get COVID-19 through the eyes. What is important is to make sure that you cover the nose and the mouth. Having said that, the type of mask you're supposed to wear, it should have at least 2 layers, which is one, the outer layer is supposed to be water repellent, and the inner layer at least should be absorbent. Or if you are lucky enough, and I'm sure these are available these days, there are also masks with the inner layer, which usually serves as a filter. So if you get a mask of 3 layers, that is the best. But the least recommended by WHO is 2 layers. And let me clarify here, when we say 2-layered mask, it does not mean 2 masks. It does not mean 2 masks because we have met people who are double masking, and when we ask them, they say it is in the WHO. The WHO says at least 2 layers. Okay. The shield, I saw somebody ask about it who is a medic. The face shield is recommended only in some situations, and it acts as a barrier. Not that it prevents COVID from getting in through the eyes. It acts as a physical barrier, like when you are doing procedures like dental, intubation. So it is a barrier because it shields any spray which would come from the patient. So it is a primary barrier. It is a mechanical barrier, not necessarily that it will protect you from getting COVID through the eye.
I don't know, would you like to comment on the water test and the fire? It was going a lot on social media.
Oh, pardon?
You know, when you put water on the mask and when you blow, yeah, are those
okay, those are the tests which are done. If you are able to blow a match or a candle through your mask, know that that mask is not very safe. And most of the masks we have, the ones which have the waterproof layer, when you pour some water from the sink, from the inner side, it usually does not pour easily from the other side. So that shows that it is a quality mask. About the burning, no, I have not seen about that so much, but it is the test when you blow a candle or a match using that mask. If the mask, the fire goes off, it means that mask is not protected well. Thank you.
Sorry, yeah. Another question was if somebody is infected with COVID, yeah, and I can see a lot of people are asking that, since we're not screening by testing for COVID, and those are the recommendation by WHO, what are our thoughts on people who have COVID and they take the vaccine?
I don't know whether Dr. Nyukuri is in the house. Nyukuri?
It's okay, Dr. Iwak.
Okay.
Okay, ideally, if you have COVID and you're recovering from COVID, it's recommended that you wait, I think it is a month before you get vaccinated. But since we know in most facilities that there's no testing of COVID before, it's actually not required that you must have tested for COVID before you get vaccinated. I think as it is, those who end up still having COVID and they had just been vaccinated, they seem to still recover, because either way we say the vaccine not only will help you to protect you from getting the virus, and hopefully it should help reduce the likelihood of you getting severe disease, that if at all you get infected, that you are not likely to suffer severe disease, because we know we are not testing before you're vaccinated. So therefore, the hope is that you'll get a milder form of the disease should you get COVID after vaccination. I hope that partly answers Dr. Amina. And just before I leave there are a few concerns that we had received. Maybe Dr. Hemba can be able to guide us if she, from the perspective of the vaccines program, that there are those who are worried that if whether they can be sure, if I guess, let's read the question, if I got the AstraZeneca as the first dose, can I get a different vaccine in the future? What are people supposed to do to make sure that they actually get the same vaccine for the second dose?
Yeah, so currently there's no data supporting mixing of vaccines. So if you got AstraZeneca as the first dose, you have to get AstraZeneca as the second dose, because remember, again, the vaccines are not like the technology and maybe the ingredient used and the virus used or the material used for formulation. And that's why studies have not so far been done on the variability. Like if I take, let's say, Panadol today and tomorrow I take Maramoja. So unlike these vaccines, we cannot, currently the directions and also advice from WHO is once you've been vaccinated with one, you take the other one. And during vaccination, you're supposed, after vaccination, and that's why MOH has been very categorical that everyone who is being vaccinated should be entered into the Chanjo system, because you're supposed to receive a message that tells you the vaccine you're given, and it tells you when your next vaccination is, so that when you go back to the facility, they'll be able to know if it is AstraZeneca vaccine that you took, that is what you're given as the second dose. So for now, people should not mix. Let's say even if we get more vaccines that will come into the country, you are not supposed to to mix and match the vaccines. Let me say it that way.
Okay, and I'm sure a lot of such mishaps will happen, especially when Sputnik is on the market, and in the event that people are getting delays in getting their second dose, they might really consider that. So we've heard it from the experts. Please do not mix your vaccines. Do not take the AstraZeneca with any other vaccine. At the moment, we have only two, so we are advocating for you just to stick to the one that you have taken. Daktari, regarding the other vaccines, when do you think they will come to the market? Because there's a lot of other people who when is Johnson and
Sorry, Dr. Amina, I kind of lost you, but was the question asking when Johnson & Johnson or other vaccines are going to come into the market?
Johnson & Johnson, but in the other vaccines as well. Do you have any idea if there are plans for them to come back in the near future?
No, currently I cannot authoritatively say that they'll come here on this day or on other day. So far, the only ones that have been given authorization is the ones that I mentioned. But should they apply for emergency use authorization, I'm sure people will be informed once they have gotten authorization for the same. But so far, it's just the 2 vaccines.
Any side effects that you're aware about of this AstraZeneca in women in reproductive health age group?
As I wait for Dr. Christabel to see if they have gotten the data on the same, I think probably for those who are either childbearing age or they will be the same category, the healthcare workers, there'll be a number of them who are in childbearing age, myself included. So the side effects are the same, regardless whether they are male, we'll say whether they are male or female. I don't know whether the person who was asking was wondering that if they conceive, or will there be any harm to the baby if they get the vaccine?
I believe that's most of the concerns that people have.
Because I think we received some guidance that you have to weigh whether the person, the lady, is at risk of infection, and therefore it would be good to be protecting. But also additionally, I think with the assistance of the Pharmacy and Poisons Board, we could start a registry, a pregnancy registry, to be able to follow up those who are pregnant and they got the vaccine. Was there any effects in terms of to the baby, so that now we can be able to have evidence, local evidence, to actually tell people that indeed there's no harm when you get vaccinated? Because I believe even during the antenatal clinics, mothers are getting tetanus vaccine, and we've never actually asked if there's any harm to the baby. So I want to take it that it should be the same way, but it would be good for us to be able to actually follow up our pregnant mothers who get the vaccine, to actually be able to say that indeed there's no harm. But again, I would reiterate, if you're an at-risk population, then you need to consider what is the choice of protection you're going to take. Thank you, Dr. Amina.
Thank you, Dr.
Just to add on what Dorothy has said, as we are all aware, these are new vaccines that have just come in. And the reason why we are saying that we need to be collecting any safety concern or any information is because this is what will guide in the future. Because again, remember, when people are coming for the vaccines, yes, it's been said that it's contraindicated in pregnancy and breastfeeding mothers. But again, the guidelines say if benefits outweigh the risk, meaning it is a one-on-one assessment with your doctor, and then they'll be able to know if you're being given the vaccine or not. So as just Dorothy has said, should someone get exposed to the vaccine and they are already pregnant, then the prudent thing will be that they just monitor the pregnancy and find out if there's any adverse event that will occur maybe on the child when they are born. Now, for the women of reproductive age, again, these adverse events have not been categorized that this will affect the men or will affect the women. So again, that is why it's important that whatever data that comes in is reported, so that should we see a pattern of adverse events that is specific to a certain women of a certain age group, then we'll be able to find out if is it because of the vaccine, is it that the vaccine has triggered it? Because like with other medication, we've seen where sometimes when people are given medication, they tell you maybe they were having their periods and then they suddenly became heavy when they started the medication. If something like that was to happen with the vaccine, again, it is important that it is reported so that we are able to get this data. And that's why we are emphasizing that this is a new vaccine. We are all learning more and more about it. And the more data we collect, the better it is for us, so that even the experts are able to review this data and guide us on as the vaccination programs continue.
Thank you, Dr. The infamous question that we always get is, alcohol. Can we use alcohol after the vaccination? How long are we supposed to stay away from alcohol? Some people are asking, is the 45 days true? So let's demystify that fact, tafadhali.
Actually have Dr.
Dr.
Christabel?
Ewak or Christabel? Yes.
Okay, currently I'll say there's really not much scientific data that has come out there strongly saying that alcohol interferes. But then again, as we know, and as we are always told, that when you're taking any medication, some of them can be affected by alcohol intake. So what I would say is better be safe than sorry, because we don't really know if this alcohol is actually interfering with the formation of antibodies when someone is given the vaccine. So again, and it's just important that once you've been given the vaccine, I know some of us cannot avoid, because this is something we have to do maybe on a daily basis or after a few minutes or something, but it will be important at least just to rest before you go back to your routine issues. But it's better to be safe than sorry, and just, just to take precautions, because right now we are not 100%. It could be, or maybe it is not, but it's good to just take precautions.
Yeah, we better be safe than sorry. I think that's the biggest take-home message, because there's not a lot of sufficient data. In fact, I don't think there's any vaccine there's recommendation on how alcohol consumption should be. It's just something which everybody is asking, and you don't have a particular answer to. Dr. Halim from WHO, I believe you have joined us. How are you?
I'm very well. I apologize for running late.
No problem, no problem. Maybe you can introduce to the audience about viral facts and what the movement is about.
Yes, absolutely. I'm just going to share my screen. Can you see my screen?
Not yet. I think we have to allow you. I'm working on that. Are you able to?
Yes, I can share now. I'm just yeah. Okay, so I'm going to start quickly with just a quick introduction. So my name is Halim, and I'm the Crisis Communications Officer for WHO Afro. And I'm coordinating this initiative that you see on the screen, the Africa Infodemic Response Alliance. That is a network to counter health misinformation and information gaps on the continent. It's a big collaboration between 14 organizations. So we have UNICEF, UN Global Pulse, IFRC, Africa CDC, UNESCO, UN Verified, Gavi, the Vaccine Alliance, and of course WHO. And we're also joined by the biggest fact-checking organizations in the region. You might recognize some of them: Africa Check, AFP Fact Check, Dubawa, PESA Check, Ghana Fact, and Medan. And the aim here is to make sure that we dispel and early identify misinformation and disinformation trends, provide a timely response, and on a regional and on a country level. One of the things that we're trying to do is follow this infodemic management framework, which is identifying misinformation and information gaps, simplifying the technical knowledge, amplifying the correct information and the misinformation debunks, strategically across the different mediums and channels, and quantifying the impact. We have different areas of work. One of them is viral facts. We coordinate the work that, on infodemic response. We work on advocating to include that as part of the response on a country level, improving the research to better understand that issue and crisis, infodemic, and providing support to the member states and advising them on how to lead and their response for misinformation. And finally, viral facts. So viral facts is a new intervention to disrupt health misinformation and close in on health information gaps, especially specifically and starting with social media. So as you know, with circulating misinformation online, there are usually just one photo, a meme, something like that. That's very highly visual and highly emotive. It generates anger, frustration, plays on how we feel. So the work that we're doing, we wanted to counter it by making sure that we produce something that is visual and engaging, and people would be encouraged to share to correct these misinformation if they see it. So who's behind it? It's all the partners behind the Africa Infodemic Response Alliance. We tested some of the examples. So we just launched actually on Tuesday. We launched officially on Tuesday. But one of the things that we tried to do is to experiment with the content that we were producing. And that content was reached 20 million people. We produce content that's very simple and very easy to use. So we developed specific templates, and these templates are very easy to populate to make sure that we share. One example, and to make it easy to translate as well to local languages, etc. One example that we have is a video that you can see on my screen. That was a debunk by an organization called Africa Check, and they're the biggest fact-checking organization in the region. This video was viewed by 8 million people, and it was received more than 500,000 engagement. It was about the claim that says that hot weather, that COVID-19 doesn't transmit in areas with hot weather. It was a very popular, of course, misconception in the region. On vaccines, as you can see, we have produced basically half of our content is about vaccines and vaccine information gaps and vaccine misinformation. The content is, of course, co-branded with WHO, UNICEF, and Africa CDC, because these are like the most trusted sources. And if there is a claim that is that one of the fact checkers has debunked, we of course attribute to them. We produce explainers, so just to explain what are certain things. So as you can see here, these are some examples. And this is actually the one to the left is an example of the first viral facts video that we did. It was about polio misinformation. So anyway, we do explainers, mythbusters, debunks, and we try as much as possible to make sure that it's explained and very easy to use and very easy to share. I'm just gonna. So yeah, so here, this is a very quick thing to explain that responding to misinformation is very tricky, because sometimes there is always the fear of amplifying the misinformation, and this is something that or giving oxygen to the rumor or amplifying one of the sources of disinformation or misinformation. So UNICEF came up with something called the UNICEF Vaccine Misinformation Management Field Guide. And it basically identified a way, or after significant research, to kind of that are effective to debunk vaccine misinformation specifically. So it starts with the facts, and then a warning, and then a fallacy, and then a fact. And this way we make it like a truth sandwich to make sure that it doesn't amplify the misinformation. And here, as you can see to the left, again, we have tailored one of our the templates to make sure that it fits into that format. So this is just a quick overview of the work that we have done since February. As you can see, like from between February and March, we have received about more than 11 million views and more than 300,000 engagements. And as you can see here, here's a breakdown per topic about the different things that we have been working on. So vaccines, as I said, like is more than 50%, and then we have we're producing misinformation literacy, which is content that would get people to better understand how to consume information online around public health, etc. Symptoms, origins of the virus, interventions, and treatments. We're hoping to do that. As you can see, there are different formats and we can do different languages. It's very easy to translate. So if there's a specific local language that we would like to capture and translate one of the videos, it would be very easy to do if we have the translations. We're hoping collectively all the organizations have a total of 10.5 million followers on social media. So we would like to capitalize on that and include more people and more organizations and more partners to be able to reach more people. This is an example about the AstraZeneca suspension. And one of the things that we try to do is to make sure that we produce very highly engaging content in real time. So we double-checked the story. We even highlighted when we started that this is a developing story and there's more. And the story we played with a Facebook story format and WhatsApp status format. These are like very highly, it goes very, very far. I mean, and even people can share them on their own WhatsApp status and Facebook status and Instagram status. It makes it very easy. And people would receive answer. Even me, when my networks, when I posted it on my personal account, people started asking me about that. And then it started a conversation, and that's very healthy because there are genuine concerns. It's not just about misinformation about, issues that are people who are malicious and anti-vax and just dubbing people as anti-vax in the region. I think it's a bit reductionist because there are genuine concerns in our region. Unlike in the West, where there are people who are actually profiteering out of this. It's much, there are people, of course, in the region who are like that, but they're much, much less organized, not less and less effective than the others. One of the things that we're trying to do is to make sure that we test the content, the messages that we produce, and the content formats and the shareability of the content. So we're collaborating with Facebook and the University of Stanford to support us with sharing that content via Facebook advertising to get a sense of the audience that we're targeting and how do they interact with the work that we are doing. I'm sure everybody's wondering, now what? What is my role and how can we participate? How can we support? So we started a new thing called Viral Facts Super Spreader. So as you know, the super spreaders is a term that has been used to describe people who have been basically spreading the virus and a part of the problem. So we're trying to play on words and to make it, let's spread the facts. So we're building a network of healthcare workers, frontline workers, journalists, celebrities, community leaders, academics, students to do one or more of these three things. So to share and amplify the content that Viral Facts have, so we can make sure that we stay in touch and we provide them with the latest content. And they would be encouraged to share it and correct people in their networks who have these questions or who are spreading misinformation or repeating misinformation. They could also support with co-design and targeting of a specific targeted campaigns for viral facts. So for example, one of the asks would be, so if we would like to educate the people in Kenya about not to consume misinformation, and what would be the references from popular culture to make sure that this is something that a message that would land and people would interact and engage with them. And finally, this could be something very simple where we share with them some examples of the content on a regular basis, and they would tell us if this is good, bad, if it needs more clarification, it's not very clear, etc. The ask is simple. To stop viral rumors, we need to share viral facts. To become a viral fact super spreader is quite easy. You just need to highlight, you need to follow the social media accounts. We are on Facebook, Twitter, and Instagram. We also have a sign-up form to kind of make it easy for people to get in touch. And we would, and if there is a collaboration with an institution or the big influencer, we can even provide access to the big content hub that we have. All of our content is Creative Commons, so it's just, feel free to use it, just as long as, you can download it and use it on your platform, as long as you just reference us and mention viral facts. This is a quick tutorial explaining how to use the Content Hub for those who would need it. And then when you share, just use the hashtags Viral Facts Africa, and in the 3 languages. I mean, in Kenya it would be in English, but that really helps us to kind of quantify the impact of the work that we're doing and to see how far our content is going. And that's it from my side, and thank you so much for your attention. Happy to answer any questions.
Thank you. That was quite a very informative session, and maybe just if you can quickly share where we can get the information. Maybe you can quickly share where we can, because a lot of people are asking. Maybe it skipped them. Maybe you can put it on the screen so that we can see where to follow, how to follow, and it can just show for 5 minutes. There are a lot of questions regarding where to get this information, and I believe it's very valuable content that we need to have on the background. So we are, while you're doing that, maybe I can ask questions regarding on the AstraZeneca vaccine. Dr. Christabel, I don't know, how long do you think how long can one single protection, a single dose, let's just say somebody went and got the 1 jab, how long will it protect them for, and what percentage will it protect them?
Currently, I can't say exactly how long the protection will be. Remember, this is a new vaccine. This is a new disease that we are also learning more and more about each and every day. So remember, what they are saying is that the vaccine, even after you've been vaccinated, you can still get COVID-19. However, should you get it, it will be a milder form. But then since the vaccination has just started round and globally, I'm sure more and more data is being reviewed, and probably will now have an authoritative statement saying that if you get COVID vaccine, you probably might be protected for 1 or 2 years. Because we also don't know, depending on the new strains that are coming in, maybe it might be like the normal flu vaccine that we get maybe annually. So like right now, I can't really say that if you're vaccinated today, you'll be protected for the following 4 or 5 years. And that's why we are still being told that even after vaccination, we still need to adhere to the other measures that have been put in place. That is washing, masking, and keeping social distancing.
Dr. Amina.
Yes,
Like
Dr. Iwak. Yes.
To just add
You
to
can
that and probably ask my colleagues, okay, from the AstraZeneca information, the guidance for the WHO of February of this year, it gave an efficacy of about 64%. But there's also additional data just when we are looking at efficacy, that you don't worry that you say that AstraZeneca is only 64%, so I will likely, maybe I should add another, because I'm seeing a number of questions whether they should top up with another vaccine so that they can expand their coverage. So I think I'm hoping Dr. Mary Beth has joined us, Dr. Maritim, so that she can be able to answer these issues of should someone go for Sputnik to increase their coverage. But also among the questions I've seen is regarding the timeline of side effects and management of the same, with people asking when do they expect the side effects. So from the reports we have received at the hospital, people are having side effects within the first 3 days. A majority of people who report within the first 3 days. So they would say maybe it's either worst on the second or the third day, but it doesn't last. For most of them, it resolves within also the same period, within 3 days, even 1 day to 3 days, it resolves. There are some who don't feel anything until 1 week later, they get some symptoms. So again, it depends on your body. We say everybody is unique in their own way. And some questions are asking, should they take paracetamol for headaches that they get? And I think it's encouraged that if you have a side effect, that it's usually managed based on the symptom that you are having. And other times we also actually recommend that depending on what it is you're feeling, you may require to come back to the health facility. So we encourage you that depending on what you're feeling, there's mild symptoms that you can just visit the healthcare facility near you and just manage. If it's a headache, just take care of the headache. But there are others, if you're feeling maybe breathless, or depending on how severe you're feeling, you need to come to a health facility. I'm hoping that there are also quite a number of concerns regarding clotting and blood thinners.
Yeah, I believe Dr. Nyukuri has joined us. Dr. Nyukuri is our so he has been quite instrumental in helping us with COVID patients and now COVID vaccine. Dr. Nyukuri, there are questions here regarding the vaccine. One, people are actually quite concerned about using different vaccines at the same time. Some people want to take both vaccines and take the Sputnik just to make sure they're quite safe. Others are wondering if one single shot is enough. And others are wondering if it will help with the other strains. I think all those questions are regarding the same thing. So if you can address them. Thank you.
Thank you, Dr. Amina. And these are very relevant questions that we do encounter every day at our vaccination site. And let me start by addressing the question of efficacy. Yes, if you look at the AstraZeneca vaccine, and depending on the research that you are reading and the country, you might get different figures ranging from 60% all the way to 80% efficacy in preventing symptomatic disease. But again, when you're looking at a vaccine and you're looking at, especially when you're comparing vaccines and probably somebody saying this vaccine is more efficacious than this, you need to look at quite a number of, where was the vaccine conducted? At that time when the study was conducted, how was the epidemic? A vaccine conducted in the middle of an epidemic, for example, when we are having a surge, the results will actually be quite different from one that was conducted in between surges. And to me, the most important thing, as somebody has said previously, is the protection the vaccine gives against severe illness, against hospitalization, and against deaths. That is actually one of the most important things, because what we are grappling with right now is our hospitals are full. Our isolation centers are full. And if the vaccine can confer protection against hospitalization, against severe illness, then actually it has done its job. Now, can you get infected after vaccination? The answer is yes, but the jury is still out on the protection it confers against infection. One thing we know is that symptomatic patients are more likely to transmit the disease than asymptomatic patients. Why? Because they tend to have a higher viral load. And so if the vaccine protects against symptomatic illness, then we can extrapolate and say, then these vaccinated people, even if they get infected, they are less likely to transmit as compared to those who are not vaccinated. And if you look at other vaccines, for example, Israel, which has been using the Pfizer vaccine, and they have vaccinated the most people in the highest percentage in the world, you can see a dramatic reduction in the number of new infections. So I believe even with the AstraZeneca vaccine and the protection it confers against symptomatic illness, if the majority of us are vaccinated with it, then I strongly believe that the number of new infections will go down. Is the how many days post-vaccination do you get the maximum protection, or the protection that we read in literature? So the endpoint was measured at 14 days after the second dose. But we know even after the first dose, there is some protection that you get. It might not be as strong as after the second dose, but protection starts at after the first dose, probably about a week or two after the first dose. So it is better to be vaccinated with the first dose as you wait for the second dose than someone who has not received any vaccine at all. Someone who has been vaccinated with the first dose has some protection that somebody who has not been vaccinated does not. Then interchangeability between vaccines. Because most studies were conducted on one vaccine. AstraZeneca, they conducted the study on AstraZeneca vaccine, Pfizer on Pfizer vaccine, and so on. Then it is recommended that you use the same vaccine, just because the studies and the evidence out there is based on using the same vaccine. Is there a possibility in future that we may, you may use a different type of vaccine? Studies are still ongoing. You can argue that because all these vaccines are targeting the spike protein, then, probably, but right now we don't have that evidence. So, and because we are practicing evidence medicine, then it's highly discouraged until we do get that evidence that you can interchange vaccines. So right now, the recommendation is, if you start with the AstraZeneca, then finish with AstraZeneca. Until you have more evidence, then don't interchange, because we really don't know what may happen, or if it may interfere with the protection that it's supposed to get. I'll stop there unless there are other questions. Thank you.
Thank you. Thank you. And a big misconception that a lot of people are asking is on infertility. And I believe we had talked about it earlier on, but maybe you can augment, either you or Dr. Miritim. Dr. Miritim, how are you? Yeah, Dr. Miritim is also our infectious disease specialist in KNH-UoN. She also practices in Bagathi Hospital. Very great assets during the COVID era. Dr. you're welcome. Okay, thanks. Okay. While she's waiting, maybe Dr. Nyukuri, you can demystify the myths going around about infertility with the vaccine.
Standing in the gap when Dr. Nyukuri.
Dr. Miritim. Hello.
Yes, can you hear me?
We couldn't hear you. We're hearing you now.
You can hear me now? I think
Yes,
I'm having
I
a
can hear you
technical
now.
problem, but you can hear me
No
now?
problem. Yes, I can hear you very clearly now.
Okay, so Dr. Nyukuri is responding or I respond?
You respond.
Oh, okay. So I could hear you, but when I tried to talk, you couldn't hear me. Thank you for this invitation to participate in this webinar on demystifying COVID-19 vaccine. So I know a lot of you might have seen or read something on social media regarding infertility following COVID-19 vaccines. However, we know that these vaccines underwent clinical trials, and so far, none of the clinical trials demonstrated that people who received the vaccines, either the men or the women, developed infertility thereafter. And we have most of the safety data that was generated at the level of clinical trials. So far, none of that data has shown that anyone who receives the vaccine may have one form or another of infertility, be they be of male gender or of female gender. So at this moment, we don't have data in support or any evidence to support that as one of the consequences of vaccination.
Okay, maybe just to take you back, there was somebody who was asking, what does it mean when somebody says a vaccine is cleared for emergency use? I thought that was a very vital question to address.
Okay, so that's a very good question because this is one of few vaccines that are currently being used under what is called emergency use authorization. So when vaccines are being developed, they undergo various phases of clinical trials, starting all the way from animal studies, where you have to inject the vaccines in small animals like mice and try to see the immune response that they generate and even whether they are safe. You don't want to give something that will even kill the small animals. After that, when the safety data is encouraging and the immune responses that are being elicited are found to be significant, then you start the trials in human, and you have phase 1, phase 2, and phase 3. And most of these phases are really to look at different aspects. So phase 1 mainly looking at the dosing strategy, the administration. So it's normally like few people take part in that, maybe about 10. Then in phase 2, you're talking of about 100 people, and you're looking at safety and even the immune response. So you have to have measures to try and assess if it's eliciting an immune response that's protective. And then you want to see if it's safe, that the person you're giving does not have severe side effects and even serious side effects that would cause, for example, loss of life. And then after that, so each of these phases allows you, when you pass phase 1, then you go to phase 2. When you pass phase 2, then you proceed to phase 3. So in phase 3, you're talking about 10,000, 20,000 people in different parts of the world, because you want to see something that may be safe in the country of origin people may react differently if they're coming from other countries. So you expand the number of people, you also expand the number of regions in which you're conducting the clinical trials. And when you're doing the clinical trials, you're following up these people very carefully, you're scrutinizing them, you want to document everything that they are going through. And therefore, clinical trials are a controlled environment when you're administering an investigational agent and you're looking to measure different things. So in phase 3, you're looking at extended safety, so safety in more diverse populations, and also looking at the efficacy and of the immune response. So when you're talking about efficacy, in your phase 3 trials, you'll have to compare people who received the vaccine and look at the people who did not receive the vaccine. And you want to see the diseases for which it's protecting against. What proportion of people who receive that vaccine are protected compared to the ones who did not receive the vaccination. So that's what you're looking at when you're looking at phase 3, which is mainly to look at efficacy. And that's what Dr. Nyukuri was talking about. When you're talking of efficacy, is the number of people who were protected or did not develop that outcome of interest while they were receiving the vaccine. So after phase 3, the companies that are developing the vaccines then provide all this data to regulatory bodies that scrutinize the data. And after that, they are able to ask a lot of questions, get a lot of data, seek clarification. And following that process, the vaccine can be licensed for commercial use, whereby somebody gets a license to be able to sell the vaccine wherever and put a price on to the vaccine. So normally clinical trials may take even up to 10 years. Malaria vaccines have been looked for almost 100 years now. HIV vaccines, since the onset of HIV, we've been looking for HIV vaccines, but we haven't been able to be successful. So vaccine development can take a lot of years. On average, it takes about between 5 and 10 years to fully go through these processes. So looking at the COVID-19 vaccines, some of the platforms or some of the innovative ways that have been used to fast track the vaccines is because people had already put in place structures to try and develop vaccines for what is called disease X. And this is a disease that's not known, but is thought to cause a pandemic in the future. So a lot of global initiatives had already put in place because an epidemic or a pandemic was anticipated, like the flu pandemic that happened almost 100 years ago. So people knew a pandemic was coming, only that they didn't know what organism would be responsible. So they had already put in place using technology and other methods to try and see if a pandemic came and you understand how the disease causes effects in the body, how can you use a safe platform to fast track the process of vaccine development? And when you're talking about emergency use authorization, what that basically means is that these vaccines are not licensed for commercial use because none of them has reached that final phase to generate enough data to say that it can be licensed for commercial use. So under emergency use authorization, these are mechanisms that have been developed by regulatory boards globally, including and even so by WHO, World Health Organization, and even the US FDA, and even our local regulatory authority has a mechanism of granting emergency use authorization. And that what basically that means, you scrutinize the data from phase 3 clinical trials and look at the safety, look at the immune responses, and looking at that very careful scrutiny, you can authorize a use of an investigational agent for deployment to control pandemics, especially in cases where there's no effective treatment, like we have in COVID-19. For COVID-19 now, we don't have an agent that we can say can cure someone of COVID-19. So we are really in a bad place where we don't have therapeutic or drugs that can be used to treat COVID-19. And therefore, under emergency use authorization, you're giving provisional permission to use these products or vaccines. And emergency use has been given for even diagnostic tests, for lab tests, as well as even for vaccines. And therefore, in this case, when we're using them for vaccines, we understand that this we are deploying these vaccines to people. Already the data that has been provided has met the threshold for safety and efficacy and generating adequate immune response to offer protection. The only thing is that these vaccines have not yet been fully licensed and therefore are being deployed. And therefore, people who are receiving this vaccine should not buy the vaccine as such because they're not being sold at the market level. But even the people who are receiving the vaccines have to be educated to make the informed consent to receive the vaccines. And that's why even you have to monitor the people to see if there could be other side effects that are noted when you receive the vaccines that were not noted in the clinical trials. So basically, in summary, that's what the emergency use authorization means. Thank you.
Thank you.
So on
yes,
what summary team? Yeah, just to also clarify, because I know someone will ask, what about Sputnik that is being sold? And as I mentioned earlier, it's because also remember the demand for the vaccines might not be met with what currently is undergoing on through the MOH. But Sputnik, the fact that Sputnik has emergency use authorization, should they declare that the pandemic is now over, then they will stop getting the emergency use authorization of the vaccine, meaning it will be revoked and they'll not have these vaccines available in the market. So just to make clear on that, and that is why you realize that despite the fact that it might be available, or other vaccines might come and available, but not necessarily through the MOH procured through maybe Gavi, WHO, you still need to provide this data using the MOH available platforms, because they have to be followed up and ensure that all data, all safety issues are followed up and concerned. And should you have also violate the terms under which you've been given the emergency use authorization, then the authorization can be revoked at any time. Thank you.
Okay, thank you very much for that. I hope the audience were able to understand the content which has been given. Again, this is a non-healthcare worker forum. The target audience are people who are not in the health sector. So regarding, there've been a lot of talks regarding AstraZeneca. German is not prohibiting it. Canada is saying, do not give it under 55. A lot of the audience is asking questions regarding that. What's your take-home message on that? What's your take on that, considering there's so much information, and in the era of if we're having a pandemic, but you're also having an infodemic, like Halima has said. What's your take on that? Dr. Meritim Onyekure?
Question, Amina. What was the question about the under 55, or just repeat the specific question? I mean,
so people, yeah, it's okay. People have been reporting that Canada and other countries have said do not give the vaccine under 50. What's your take on that? I don't know if you're familiar with such policies. Okay. There were some policies that were passed.
Specifically for AstraZeneca or for which
I
vaccine?
I believe it's specifically for AstraZeneca. I'm not aware about the Canada one, but it's in the forum.
Oh, so when you're looking at even the age groups that have been selected for vaccination within our country, we are using our local data to inform prioritization, because through the funding mechanism. So first of all, the supply of the vaccines is lower than the demand. More people need the vaccine, but what is currently available is little vaccine that has to be shared among all the countries. So we have very few doses that are available. So the country had to come up with a prioritization mechanism to see how to offer the few available doses to the people who you would say maybe deserve the vaccine the most. So looking at our data, the data we get daily, the National Emergency Operations Center is able to compile the data. We know who's getting infected, the severity of the illness that they are getting, and how many people are losing their lives on a daily basis, and even what are the attributes of the patients who we are losing on a daily basis. So looking at all those statistics from our local data, most of our deaths are actually in people who are older than 50 years. A lot of other people who are dying could be younger people, but they have chronic illnesses, what you call comorbidities. So based on that prioritization data, the vaccine program, because of the few limited doses, then had to prioritize who to offer the vaccine to, given the limited number of doses and the people who are likely to die. So majority of our COVID-19 infections in the previous 2 waves have been asymptomatic and mild illness. Many people do qualify even for care under home-based care. But in this current 3rd wave, it's changing and we're collecting additional data. So based on that, the people who've been selected for vaccination in our national, through these vaccines that we currently have, are the older age group. So people who are older than, I think in the deployment plan, it's planned to be people 50 years and older, but I know we've prioritized people who are 58 and older for inclusion in phase 1 that is currently being rolled out. So in other settings where the same vaccine is being used in Canada and in US and in Europe, one of the things you have to understand, in those countries, they put a lot of their own internal fundings to fund the pharmaceutical companies that develop the vaccine. so the Pfizer vaccine and the Moderna vaccine. And a lot of resources were put aside and given to the pharmaceutical companies to be able to get the vaccine out into the market. And these countries even put a lot of resources to buy the vaccines for their own nationals. So they have choices of different other vaccine types that we don't have within our setting, because those vaccines require very cold temperatures to transport and store. So they are not feasible to use in our part of the world unless we spend much more money to put in place the infrastructure. So in those settings where they have different vaccines, then they are able to say, for this age group, we recommend this vaccine. For this age group, we'll recommend this vaccine. For this age group, we'll recommend a different vaccines. But in our country, we don't have that luxury. So far, we have only the available vaccines, which you've heard about by the previous presenters, and the AstraZeneca, which is being rolled out by Ministry of Health, which we are giving for all age groups, including even the frontline workers who have not talked about. Frontline workers were prioritized because of vulnerability in terms of exposure, because in their day-to-day working, serving the public, then they are likely to be exposed, particularly because of occupational risk, like the healthcare workers, the teachers, and the security forces. So that's just a summary of the different age groups. But the vaccines in clinical trials were safe across the different age groups.
Okay, thank you. Thank you very much for that. Maybe I shift a little bit to Halim. There's a question here. Somebody is asking about, there's a rumor going around, since injection site pain on the deltoid muscle is quite painful, we need to start using the gluteal muscle. Mine is to ask, is there a way that we can start labeling meme? Probably we put a disclaimer. This is a meme. This is for social media purposes. You know, like, is there a movement like that? So that we can be able to easily know the difference of something going viral because it's humorous and something going viral because it's educative.
Yeah, that's a great point. And I think one because we keep track of what's happening on social media on a weekly basis across the region. And one meme that was actually really funny, but at the same time, yeah, it could be a bit problematic for people's understanding about the vaccines. But it was this meme with different vaccines standing next to each other as muscular men, and one of the vaccines was a bit you know, overweight and stuff like that. I think there is there are, when we talk about infodemics and misinformation in general, there's this also touches on freedom of expression and human rights and all of that. And what we recommend is that we try as much as possible to spread more information, and more correct information, and tap into these kind of mediums through creatively as possible. And that's why I think that would be an incredible thing to try and work on together with the viral facts super spreaders, which is to develop informative and educative memes that would be funny but actually focusing on the correct information and tapping into that network and that kind of audience who's consuming information through memes. We get a lot of information through very different ways and formats, even without realizing, and definitely memes is one of them. It's going to be very difficult to kind of tag memes, and technically it's impossible from a technical point of view. But at the same time, what we can do is that we can create better memes. And that's our approach with viral facts, is create better content with the facts, with correct information, using the same ideas and the same mediums and the same formats, so we would be able to compete with it and let the best content win, I guess. And then we, at the end of the day, we try as much as possible to make sure that we have a networked approach in how we do it. And with more people like the great questions and the great audience that we have today interested, we will have better and stronger ambassadors who would be correcting, you know, wrong information and misinformation about these things, and they would have the tools by having this kind of content available at their hands.
Thank you, Halim. So we have talked a lot about the vaccines and different things like the vaccine we have available is AstraZeneca. Now we've talked about what we expect, how many doses we're supposed to get, and we've also demystified using other vaccines for the audience who have just joined in. There is a question that I feel like we have not really properly addressed is regarding COVID-19. In the event that somebody has gotten COVID-19, how long will it take for them before they can actually take another the vaccine? Would it affect them? What are basically the symptoms we're screening before taking the vaccine? Dr. Nyukuri, I don't know if you. Dr. Iwak, I can see you've raised your hand. You can.
Yes, I was not going to answer the question of the COVID vaccine, but I noted not on the questions. There are two attendees who have talked about more or less serious events which have occurred after vaccination. And I would want to hope that the Christabel can be able to share how they can be able to notify the health facility, so that now we said for any event, you need to be able to notify the health facility so that now that information can reach the Pharmacy and Poisons Board, and an assessment is done to establish whether that was actually vaccine related or just by coincidence. And the same is communicated to the one who reported, so that at least you know if somebody close to you had suffered a serious event, say after they got the vaccine, and you want to know, is it because of the vaccine? Would encourage you to notify, and I hope Christabel can be able to show how it is they can go about notifying the board, or you could even just visit the health facility that you're in. And I wanted to ask a question for some of those concerns, whether, let's say, rumors, if I'm as a member of the public, if I want to know, is it true really that somebody who is is it true really that I'd have clots if after the vaccine, and I want to the viral facts to be able to ascertain or to find out this information? How do I share the rumor, so to speak, that I have had to viral facts, so that now they can be, and how long will it take for them to respond and dispel the issues that are there? Thank you.
Can I jump in on this?
Yes, jump in.
That's an amazing question, and I'm sorry I didn't cover it in my presentation, but we actually have our messages are open on both Twitter and Facebook, so people can message us, and we will try to have turnover to go back and respond within 48 hours. One of the thing, I mean, there's a lot, again, as I mentioned, there's a lot of work going on to dispel misinformation and to correct misconceptions. And we're having a growing library of things. So I can see many of the concerns that have been already raised on during this forum. We have actually responded to them, and we already have content for them. And I have posted one example in the chat. But for stuff that because this is keep growing and new things, we are hoping to on a weekly basis, we produce an average between 3 to 5 new pieces of content dispelling misinformation. We have limited capacity, so that's why in terms of viral facts content, turning it into viral facts videos and content, that's the thing. However, there are a lot of resources. So WHO official accounts, we have a lot of content clarifying that. We have the fact checkers. There are debunks that have been done from our partners that we can share with you. So if you have any questions, please send us a message on our channels, or just if you would like to tweet or just post something, just use the hashtag VFA check, and that would be and we are keeping track of that hashtag, so we would be able to kind of get a sense of any rumor around this. And again, we're hoping to within a week, if it's something completely new that hasn't been covered, within a week we would be able to send you or within, we would be able to send you an update.
Thank you, Halim. I believe you're working with many experts from WHO and in Kenya and in Africa in general. So I believe the timeline makes perfect sense.
Okay, just what Dorothy was saying in terms of reporting, I guess maybe the presentation was too fast. So on the PPB website, if you type in pv.pharmacyboardkenya.org, you'll be able to see a reporting platform, which we have two options. One where you can report as a healthcare worker, or the other one is for the general member of public, which is a more simplified tool. For those who are not able, we had also provided a number 0795. I'll put the numbers on the chat and the link, which you can call. But then again, as Dorothy said, we also encourage that members can still go back to where they were vaccinated. Actually, at the point of vaccination, the nurse usually provides you information. And in an ideal situation, you're supposed to remain at the vaccination center for at least like 15 minutes to be observed should there be any adverse event that can occur. But should you experience them when you're outside the facility, you can get in touch with the facility, or you can visit the PPB website or the phone number that I'm going to put in the chat. And then you're able to call and say you've experienced an AEFI. We'll be able to find out where did you get the vaccine from, and get in touch with the facility, because it's important that we pick information on the vaccine. That's why we need to know where you got it, so that we're able to know which batch number, which brand of the vaccine, at what point were you vaccinated at the time, so that as we are doing what we call assessment of these forms, we are able to do it well with all the data available. Yeah, so I'll be typing that in the chat box.
Thank you very much, Dr. Christabel. So just before Dr. Maritim, I will repeat the question for you just in case you haven't had. But there's one of the participants, Bethwell. You have raised your hand. I've given you permission to speak. I don't know. Are you able to speak? Bethwell, kindly unmute and ask your question. Oromo. So while we're waiting, Dr. Maritim, I was asking regarding to if somebody got COVID-19, how long should they wait before they get the vaccine? A lot of questions regarding that is being asked.
So that has been a frequently asked question. Even when people call me, they want to know when they can come for the vaccination after recovering from COVID-19. So I know our national training material recommend that you can come 10 days after recovery, but some of the international data or some of the handouts that other countries have prepared for people receiving their vaccines in their countries even suggest that you should wait up to 4 weeks before you can receive the vaccine after recovering from COVID-19. And this 4 weeks is from the time of your positive PCR test, so that if my PCR test came positive today, I cannot come for the vaccine 10 days, I wait up to 4 weeks. And the reason for that is that in that period of 4 weeks, when you recover from natural infection, you have some circulating antibodies. And even when people are getting reinfected, because one infection may still predispose, you might still get COVID another time. So we haven't had people who got a reinfection within that 4-week period, which seems to suggest that the antibodies that you get from natural infection are able to protect you. The only thing we don't know, the durability of those antibodies. So if you've recovered from COVID, you can wait and receive your vaccine 4 weeks later. And even when you're looking at the vaccine, you have probably been told on this webinar that we are giving 2 doses, and the interval between the 2 doses is anywhere between 8 weeks to 12 weeks. So for some of us who already received the vaccine, we were told, our message came that we go back for our second dose 8 weeks later. So when you get the natural infection, it acts like your like primary dose, or what you call the prime dose. And then the second dose is the booster. So for people who've gotten COVID-19, we are still waiting for data from clinical trials, but it may seem that those people may only require one dose as opposed to the 2 doses. But I know the manufacturers have recommended everybody receives the 2 doses. But if you're recovering from COVID-19, I know I've said a lot of things. Wait a period of 4 weeks and present yourself for the jab after a period of 4 weeks.
Thank you. So 4 weeks after the jab, I hope that is clear enough. I think with COVID, things are very dynamic. Things keep changing. Regarding the clots, and I can see from the poster, the vaccine is not associated with an increase in the overall risk of blood clots in those who receive it. So in case to get blood clots, I think that question has been a history of blood clot. Is it safe for you to take it, Dr. Meritin?
So there had been reports a few weeks ago of the vaccine being related with clots. And this was first reported within the European region in several countries around there, maybe about 4 countries within that specific area, where they were noticing that people who are coming in with clots and they were trying to relate it to the COVID-19 vaccination. So a total of about 37 cases were reported out of about 15 million people who had received the AstraZeneca vaccine in that geographical area. So when the European Medicines Agency looked at these cases and scrutinized the cases and tried to relate the presence of the clots with the vaccination, they could not find sufficient evidence to actually say that it is a vaccine that had caused the clots in those specific people. And one of the things we also have to remember is when you're trying to say the vaccine is responsible, you are trying to describe that these people got the vaccine, and you can say the mechanism through which the vaccine then is able to cause the clot. But so far, in the 37 people, it wasn't explained fully by the vaccination, because even around the same time, there were several cases of clots which could have been related even to COVID-19 as an infection. So at this point in time, the vaccine is not directly related with the clots. So having said that, this has been also a very frequent question. People want to know, I was treated for a clot in my leg, I was treated for a clot maybe in my heart, should I get the vaccine? So what we currently know is that for people who have previous clots, there is no increased evidence that receiving the vaccine will worsen the clot that they are under treatment, because some people who have clots are on long-term medication like warfarin to thin the blood. So we don't currently have evidence to say that receiving the vaccination would worsen your clot or would give you another second clot if you've already suffered from one current clot. So there is no contraindication to receive the vaccine if you've suffered a previous history of clot. What you are cautious about, and I think this was probably mentioned to you as one of the precautions for people who are on who have bleeding tendencies, they have to be careful and declare to the healthcare provider who's giving them, because this clot is given through an intramuscular injection on the left arm at the deltoid area. So when you're giving intramuscular injections in people who have, for example, clotting problems, then it can present a challenge. So that is just one of the precautions that we have. But in terms of people who have already been treated with clots, who are on long-term medication, they can still receive the vaccine. We don't have sufficient data to say the vaccine will worsen your clot at this point in time.
Thank you, Dr. very much. Thank you to the panelists who have joined in and given us the immense educative materials to be able to demystify COVID-19 vaccination. In summary, we have learned about the data, what's happening in Kenya, how we are supposed to report. I believe Dr. Christabel has shared the website where we can do self-reporting. Halim has shown us how we can get the correct facts in Africa in terms of COVID-19. He's shared the Twitter handle, the Facebook handle, and in it you'll get many educative videos. And he's also shown you how, if you want to demystify something, how you can report to them, and the timeline is a week for them to be able to respond to your message. I don't know, do you have any parting messages, the panelists? Maybe I can start with Dr. Iwak.
Thank you, Dr. Amina. And to just appreciate those who joined us, and I'm pretty sure that everyone has an impact somehow in their sphere of influence, or at least there are those people who listen to you. So I want to encourage that we give the right message, and when we are unsure, can we just clarify so that we don't create a scare or panic, as we know we are living in a very difficult time. But I want to encourage that if you have any issue, please reach out to the healthcare provider or facility near you. And let's just be part of the change to be able to correct the message that is circulating in the public. Thank you.
Thank you. Dr. Christabel?
Just to say thank you guys who've taken time to attend the webinar. And as Iwak said, let's be the agents of change. Let's make sure that all these reactions, or should you see maybe one of your friends who says they took the vaccine and they are talking about the events, ask them if they've reported it, because as Dr. Maritim explained to you, the data during clinical trial is a bit limited based on the number of participants they use. But then, as you can see in the real world, we are exposing millions and millions to these vaccines, and we just need to be sure that everything is okay. Should there be anything of concern, that it can be handled immediately, rather than waiting maybe after the whole vaccination period is over. That's when we hear, oh, during that time, we had ABCD and this happening. So just the number we've given, in case you have any safety concerns or queries, you can still call, and we'll be able to respond to you. Thank you.
Thank you very much. Kibiwot?
Maybe what I need to say is that we should continue the COVID precautions. Those who have not reached the critical mass of those vaccinated. So masks is a must. We must wear masks all the time, because we are trying to prevent those ones who have not been vaccinated from getting COVID. Because remember, even with the vaccine, it will just reduce the fear of you getting the severe disease, but you can still transmit to somebody else. So we continue wearing our masks and generally following the COVID-19 protocols as per the Ministry of Health protocols.
Thank you.
Yeah, I think that's all for me.
Thank you. Dr. Maritim?
Yeah, I wanted to use my parting shots to answer a question that I've seen there in the Q&A that's asking about, is there a situation where one is not recommended to take the second dose based on severity of reactions from first dose? I don't know that you were able to answer that question, Amina, or I can tackle it now.
No, tackle it kindly.
Okay. Yeah. So one of the contraindications for the COVID-19 vaccination is what is called anaphylactic reaction. So anaphylactic reaction is a serious adverse event because it can be life-threatening. And this is whereby when you're injected, you might not know that you are allergic to one of the what is called excipients, or the components within the vaccination, of which there are several components, but it might only, this might be discovered at the time when you receive the vaccination. And in an anaphylactic reaction, we are talking of that your body starts to swell, like your mouth swells, your tongue swells, your airway swells, and you're not able to breathe, like your eyes swell. You get generalized body swelling that occurs from the time of injection to about 15 minutes. So it occurs fairly rapidly within the first 20 minutes or so after administration of the vaccination. So that is would be considered as a serious adverse reaction because it can cause loss of life. So far, it hasn't been seen with the AstraZeneca vaccine, but as a precaution, each facility that's administering the vaccine, the healthcare workers have been trained. The healthcare workers have on-site equipment to respond to somebody who develops an acute anaphylactic reaction. So they have medicines that they can inject you with, and as part of to stop the ongoing reaction. And anyone who develops anaphylaxis to the first dose, then they are contraindicated, like they cannot receive a second dose because that reaction is likely to be predictable and you'd get the same reaction following the second dose. So that is an absolute contraindication to receiving that second dose. But healthcare workers are trained, and the facilities that have been selected, remember, these vaccines are being given in healthcare facilities that have already been vetted, and the healthcare workers are being trained to be able to detect and respond to any of these acute reactions when they develop. And even after receiving the vaccination, you are not allowed to leave the vaccination place until you've finished 15 minutes of observation before you can be allowed to leave. So there are safety nets that have been put in place to try and prevent and detect and respond to any anaphylactic reaction that might occur in people who may have some allergies to some of the vaccine components. So I just wanted to clarify that and to assure you that all has been put in place to try and reduce the risk and minimize the risk that may be seen. But so far, no anaphylactic reaction has been described with the AstraZeneca vaccine that is currently being administered. Thank you.
Thank you, Doc. And just to clarify, is protein or egg allergy, because there's a lot of misconception. Personally, I had it at some point that if you have an egg allergy or a protein allergy, you can't take the vaccine. Can you kindly demystify that as well as a parting shot?
So for this specific vaccine, having an egg or protein allergy is not a contraindication. You can still receive the vaccine. And the reason for that is that this vaccine is not prepared in eggs. And this vaccine, in terms of the components, doesn't share components with people who probably have allergy to other proteins, because most of the protein allergy, you get the allergy when you eat the protein, and the protein gets into your body system. For the egg allergy, some vaccines are developed in eggs as part of the maturation process, but particularly for this vaccine, it doesn't go through that process. So people who have these two allergies, they can still receive the AstraZeneca vaccine because it's not made using this technology.
Thank you, Dr. Halim?
Thank you so much. And I think my final thoughts here are twofold. Firstly, I just want to acknowledge that there's a lot of uncertainty around COVID-19, and it has really thrown us off during the past year and a half, and it has really changed the way we live. So I really want to acknowledge that and make sure that everyone on this webinar would kind of feel okay to ask questions and to be encouraged to ask questions, because during this time of uncertainty, the only way to kind of get clarity on things is if we are able to ask questions and tackle misinformation and understanding how misinformation works and how can we address it. But there are the majority of the questions, there are legitimate concerns, and they're just genuine information gaps. And again, like when it comes to vaccines, there's a lot, and with COVID-19 in general, there's a lot that we don't know. But to the best of our knowledge, to the best ability, to the and as the experts on this panel have shared, there's a lot of limited data out there to kind of move on things, but the science is there, the methodology is sound to make recommendations. So the last point, or the second part of my my final thought, is that to the best of our knowledge, the vaccines are safe. According to all the scientific data that has been generated, the vaccines are safe and are effective, and that the risk of contracting COVID-19 is much more fatal than getting the vaccine. Nobody will die if they get the vaccine. To date, no one has died from COVID-19 vaccines of any kind, but you can see how many million people have died out of COVID-19. So just something to consider and to reflect on. And of course, that doesn't undermine all the legitimate concerns, all the concerns like any other medicine. There could be side effects, varying from one person to the other. Quite important to acknowledge that, but that doesn't mean that we stop taking the medicine. That doesn't mean that we stop, dealing with things. But if there are certain adverse events following the vaccination, as again, all the experts have mentioned, there's a very thorough and detailed way to kind of spot any adverse events, to kind of treat them, to make sure that this happened. So far, the situation is very promising, and I would like once again to encourage people to pre-list if they are part of the priority group in the country, to pre-list and to find the best way to kind of register themselves to take the vaccines, to encourage them to get more information and ask all of these questions. And hopefully we'll be able to get rid of COVID-19 thanks to the wide range of tools that we have in our toolkit, including the vaccines that give us a head start on top of the different measures that we're following, such as social distancing and masking up, etc. Thank you so much once again.
Thank you again, the panelists, for taking your time in demystifying COVID-19 vaccination and giving us a lot of information whereby we can fact check and we can report, we can do a lot. Thank you for raising awareness. This is a first of the series for non-healthcare workers, which we are planning to have many more. Kindly, if you have any suggestions on how to do it better or which topics you'd want to be covered, you can always send an email to knhresearch@gmail.com as projected on the screen. Again, thank you very much for your time. Have a lovely afternoon and good day. Bye-bye.
Thank you very much, and bye.
Thank you. Bye-bye.
Thank you. Bye.